I'm a board certified infectious disease, wound care, and obesity medicine doctor at Diabetes Center in Augusta, Georgia. Just wanted to talk about age of decay. This is the week of non-communicable disease and action week against non-communicable disease as advocated by WHO. And part of that, I'm trying to contribute to the improvement of the understanding regarding the pandemic of non-communicable disease, which is contributing to the worsening of the pandemic of COVID. And in fact, non-communicable diseases are the pandemics in slow motion. I'm a board certified doctor with Twitter handle at wound physician and hashtag removing barriers to healing. My conflicts of interest are nothing but removing barriers to healing for infectious disease, wound care, obesity medicine using people, process, and technology. Wanted to discuss about ages of disaster, age of disease, and age of decay. During the times when we had problems with dinosaurs or huge animals, that time would be considered as age of disaster or trauma when we could not control the outcomes. The next one during early centuries were early 1900s when we had all the diseases. That era would be called as era of diseases. But something amazing happened in 2009 when WHO declared that non-communicable diseases have overtaken communicable infectious diseases causing a problem. So the morbidity and mortality rate because of non-communicable diseases worsen. And I think there is underlying basic common mechanism that is affecting these non-communicable diseases. And after I have been a doctor for infectious disease and practicing for 15 years, I came to an understanding that the outcomes of diseases from an infection standpoint have non-communicable disease underlying mechanism. And I'm trying to hopefully make some dent and help with prevention of infections. Chronic diseases in America affect a lot of our population. 90% of the nation's cost is because of chronic diseases. It's 90% of $3.5 trillion annual budget, which is almost 18 to 20% of the GDP of United States of America. And 6 to 10 adults have chronic diseases, and 4 in 10 have 2 or more of those chronic diseases, which include heart disease, cancer, pulmonary problems, stroke, Alzheimer's, diabetes, and kidney disease. And lifestyle diseases are involved, including alcohol and tobacco and lack of physical activity. But those 3 pale in comparison to poor nutrition, which is almost 80% of what is contributing to this healthcare crisis that we are in. Coming to diabetes, in US, there's 42% of Americans who have diabetes or pre-diabetes. Of them, 30.3 million are diabetic and 84.1 million are pre-diabetic. From a world perspective, 415 million people are living with diabetes, and that is expected to rise to 642 million by 2040. The major countries that are affected are by population China, India, which is 69 million people, and US 29 million people, with Brazil and Russia following. Center for Disease Control classifies that more than 70% of adults are overweight, but 40% are obese. Now, most of these overweight people also fit into the criteria for metabolic syndrome. And worse is people are trying to lose weight, but they are not able to keep the weight loss sustained, and they are continuing to regain weight over time. There's multiple reasons for that, and we'll talk more in the future videos on that. But what we have to understand that there is multiple guidelines that tell us that modest weight loss helps in health status and quality of life, and there's multiple studies to prove that. But how we get to that spot and how we keep a sustained weight loss and sustained lifestyle is the key that we have to address. Coming to the pandemic issues that we are talking at this point, we are in the midst of coronavirus pandemic of COVID-19, but we have to understand that it's a perfect storm of two pandemics with obesity, diabetes, and also really it is fat mass disease that is causing this problem with viral inflammation on the top of obesity inflammation. In a normal person, if it is a female, when the fat mass is more than 28%, and when the fat mass is more than 14% in a male, then we start having trouble with the healthy T cells get secluded, or the macrophages or T cells get secluded, and the macrophages which cause inflammation are dysregulating the whole problem, and we are in metabolic dysregulation, and our immune system is trying to protect ourselves from us. So the over fatness or the metabolic syndrome or our own fat tissue becomes a toxic problem that we have to take care of, and that impairs our immunity. And COVID-19 happens to be that last straw on the camel's back. And our worry at this point has to be, yes, we don't have the vaccine yet. Yes, we don't have the great treatment yet. But we have to understand that we did not survive. Humanity did not survive all this time with vaccines. Yes, there are vaccines that help us, but the eras, the decades of the disease, and we did not survive all this time with the vaccine. We survived because we had the innate, God blessed immunity that gave us this chance. We need to improve our nutritional status to be ready for the inevitable viruses or bug of the day, which is like the last straw on the camel's back. We have to understand that metabolic syndrome reversal, which is nothing but a complex of 5 criteria that we have to understand. But the root cause of that 5 criteria is nothing but hyperinsulinemia and insulin resistance. We are to be working towards removing barriers to healing by beating non communicable diseases and get ready for the bug of the day, which is nothing but COVID-19, but also future bacterial pandemics that we might be facing, or the viral pandemics that we might be facing. The 10 factors beside age, which we cannot stop, are death and taxes and age, we cannot stop. But we have to understand that we have to change our environment, lifestyle, immune system, and lipid system that can be changed by our nutritional system that will help our genetic expression. And obesity, metabolic syndrome, diabetes, hypertension, and immune problems, immune suppression that we face, and cancer, lung diseases, impaired immune system, and prolonged exposure and a viral load of exposure to COVID, if somebody is exposed, has a huge impact on outcomes. And what I try to call this is a concept of disease triangles, which we'll talk at a separate video. But we have to understand that everyone has a doctor in him or her, and we just have to help in working towards finding that doctor. We have to understand that our food should be our medicine. Our medicine should be our food. And to this end, we have to deliver services and solutions that empower the patients and help them find the doctor in them. We have to understand that all medicine is personal and every patient is a puzzle. And as health system, we have to move away from mass medicine mindset to an N of one medicine. Please feel free to contact us if you need any help. We are in Augusta, Georgia, and we are a diabetes center working towards empowering specialist care for diabetes, infectious disease, wound care, podiatry, endovascular, and metabolic syndrome issues. Our phone number 706-868-0381. Thank you very much.